My name is Emily Stampa.
And I'm Kaylee Nipper, and we are the FGCU interns at Florida Southwestern State College. And we work with the men and women's basketball teams, the volleyball team, softball team, and baseball team.
At this site, we are split up between two facilities. At the first facility, we go to the arena where we work mainly with the men and women's basketball along with the volleyball team. But here at City of Palms, we work mainly with the softball players and the baseball players.
And now we'll show you a tour of both of our facilities.
This is the training room at the arena, and right here we have the ice baths, and in the back the ice machine. Right here is where we keep all the medicine for the athletes, and in that room right there is where you're going to be working. It is your office. Over here we have the small tables for where we do ankle taping, and on the floor over here is where the athletes, like basketball players, learn how to jump higher. Right here we have our treatment table and the STEM machine. In here is our weight room at the arena. At the front of the weight room we have a whiteboard where we write all of the workouts. Spread out in the weight room we have circuits for the athletes. This weight room offers us a lot of different workouts that we can do because there are so many machines and so much space.
And this is the gym at the arena for the basketball and volleyball teams, and we are here during practices and games in case there are any injuries that occur. Here is the softball side of the training room at City of Palms, and this is the office. And this is the baseball side of the training room where we have an arm ergometer and miniature trampoline for plyometric work, the training tables and STEM machine. This is where all the tape and medications are. And this is the heating pad station where there are hot pads in the silver container. And this is where the tubs are for when athletes need to use an ice bath. And this is the weight room where the baseball team does all of their workouts.
At the beginning of the semester, one of our site supervisors created activations for the baseball players each day. These activations consisted of 8 to 10 stretches, and the stretches began at the top of the head, working their way down to their feet. A few examples of these activations include peanut neck release, barbell trap release, lat dowel stretch, Captain Morgan rotations, banded pigeon, fire hydrants, and the lacrosse ball foot release. This was very helpful for the athletes because now, instead of just the site supervisor coming up with ideas, we have 2 extra people with 2 different mindsets on how to form these activations. This was also very helpful for the athletes because they have a whole lot more movements to work with. Ultimately, these activations were to provide athletes with many different options for stretches and exercises before lifts and practice. During your time with us this semester, what do you believe was the most effective treatment we provided for you?
I believe that the best treatment was the therapy given to me for my ACL tear. It was very beneficial. It helped me get mobility back in my knee, and I feel like I'm almost at 100% now.
If there was one word you could use to describe your experience with us, what would it be and why?
I would say consistent. Every day that I came into practice, they checked on my knee, made sure that it was all right, and follow up with the required rehab exercise for that day. And they progressed it through the whole fall, never missed a day.
Is there anything you believe we could have done differently this semester?
Personally, I feel like this semester was good for you guys. For my knee at least, I think the only suggestion I would make is different variety of knee rehab exercises, because I feel week after week it was about the same exercises, And collectively, I would say more understanding of the sport of baseball and what motions are involved and how to incorporate those to our exercises and the lifts that we would have.
When going through rehab and treatment plans for athletes, we are able to learn about the common types of injuries that can occur through each sport. We are also able to learn that there are many different ways that an injury can occur. Rehab techniques that we used were myofascial release, cupping, scraping, stim, the Normatec, game ready, and therapeutic exercises. During times, the training room would get very busy, and it was helpful that we were there to help out our supervisor and make things go a little quicker and run smoother. Also, when taking athletes through rehab exercises, we were each able to work one-on-one with athletes instead of having to work with multiple athletes at the same time with many different injuries. This allowed each of us to focus on one athlete at a time and make sure they were doing their exercises correctly. Throughout the semester, we've been able to work with this softball athlete as she has gone through rehab for 2 knee injuries. This exercise is a terminal knee extension, which helps strengthen the quad. This is a newer exercise that we've been having her do more recently as she has progressed into more rotational type exercises. Okay, during your time with us this semester, what do you think was the most effective treatment that we provided for you?
I'd have to decide either between scraping and deep tissue massage or ice and stim. Depends on the day. I feel as though if I had a stressful day on my knees, I'd prefer scraping and the massaging. But if I just need to just get some ice on it and get the inflamed muscles to go down, definitely ice and stim.
If you had to choose one word to describe your experience with us, what would it be and why?
I'd say genuine because it was pretty clear that you guys really wanted me to get better throughout the span of the fall. After one injury and then after the second one, you guys just put everything into it so that I could get better and get back out on the field.
Is there anything that you believe we could have done differently throughout the semester?
I think you guys did a great job, but just one thing would be being more confident in your ability and your knowledge, because you both have worked so hard to get here. You gotta execute and put your knowledge out there.
At the arena gym, we do workouts for both volleyball and softball players. The volleyball players start at 7 a.m. and the softball players start at 6. During the lifts, we are here to organize the stations, cue form, as well as correct if needed, and answer any of the athletes' questions if they have any.
Here's an example of a softball workout that we have assisted with. Each workout is set up into 5 different stations where the first 4 are focusing on either upper body or lower body, and the 5th station is focusing on the core. During the fall semester, the softball team worked out 3 days a week, which were on Monday, Wednesday, and Friday. On Mondays, they focused on lower body. On Wednesdays, they focused on upper body, and Friday was a combination of upper body, lower body, and core. After spending some time in the weight room, we have noticed that athletes will tend to do the cable face pulls incorrectly. They want to bring the cable towards their chest when it should be coming right towards their nose. Here the athlete is being shown the proper way to do this exercise. Now after cueing, she's doing it correctly by bringing the cable towards her nose. This half kneeling cable rotation is another exercise that many of the athletes need correction with. This athlete has the wrong leg up and she is also holding the cable a different way. Now she is having another demonstration for the correct way to do this exercise. Here she's doing it with the correct knee up and holding the cable the correct way. However, she did not twist with her whole body, she was just rotating with her arms. Now she's using her core to rotate as well. At the beginning of the semester, we conducted assessments on the baseball athletes. This helped us to get a baseline for each athlete and see where they were at. Assessments that we did included FMS, range of motion, and manual muscle testing. Here is one of the athletes completing some of the FMS movements. The two movements shown are the deep squat and the inline lunge. The functional movement screening is used to bilaterally evaluate fundamental movement patterns such as mobility and stability in athletes. It is not used to diagnose any type of issue or injury that the athlete already has, but it is used to determine any asymmetries that may lead to a risk of injury in the future. By having this information, we were able to alter lifts if needed, and we can also create personal exercises for those athletes where we found deficits. For example, through the assessments, we found that some athletes had poor hip mobility, so we created exercises and stretches for each of them to do that will improve their mobility in their hips. This exercise is a variation of over the fences. This hip mobility exercise is used to open up the hips and to give a good stretch to the muscles that run through this area. It is important to keep the hips in line with the wall and to make sure that they do not rotate outwards too much. The athlete will do this several times on each leg. A way to make this exercise more challenging is to have the athlete step away from the wall and do it without resting their hands on the wall. Here's another great hip mobility exercise that we have learned. A way to progress this would be to have the athlete lift their feet slightly off the ground. This exercise is the 90-90 hip rocks. It is great for hip mobility because it incorporates internal and external rotation into one movement. This exercise can be very challenging for some athletes, and we have found that many of them are not able to complete it without falling backwards. Here is a hip circle exercise to help with mobility. An important part of this exercise is having the athlete keep their hips facing the floor and not tilting out to the side. After working on this movement with many of the athletes, we have noticed that most of them have trouble keeping their hips in line. One cue to help them focus on their hips is to place a hand on the hip that is tilting up. This is to remind them to keep it down. Another thing that we do is place a small foam roller on their lower back. They have to try and keep the foam roller from falling off of their back. This is another athlete who at the beginning of the semester we found that he had very limited internal rotation. This stretch is called the sleeper stretch, and it has definitely helped to improve his internal rotation throughout the semester.
The following are some extra tasks that we do at our site from time to time.
Something that we do at the arena is make ice bags for the players for when they are practicing. At the beginning of the semester, we were taught how to properly make an ice bag. The most effective way is to flatten out the ice, blow a little air into the bag, and then suck the rest of it out, making sure there is no air left inside the bag. Using this technique makes it easier to form around a part of the body such as the shoulder. Each morning at the arena, we would make about 5 to 6 ice bags and set them in a Gatorade cooler. We would then place it outside the door for any of the players to use. Oftentimes after practice, athletes will come in wanting ice for a certain part of their body. We have learned how to effectively wrap the ice on various body parts such as the knee, shoulder, elbow, low back, or shins. It's important to wrap the ice where it's tight enough that it won't fall off, but not too tight where it becomes uncomfortable. The Game Ready Ice Machine is a very cool piece of equipment that we get to use on the athletes. It's very similar to the Normatec, where it provides compression to a certain area of the body, but the Game Ready also flushes ice-cold water through the compression wrap. In order to use this, we have to fill the box up with ice and then fill the rest of it up with water. Here's an athlete who is using stim as well as the Game Ready on his knee. One thing that we do just about every day is stretch out the athletes. Here is a sped up clip of the process we use when doing a lower body stretch on the players. The majority of the players come in asking for a lower body stretch compared to upper body. At the beginning of the semester, it was a little challenging to remember all of the stretches to do, but now we do them so often that it comes natural. Now, here are the steps we take when doing an upper body stretch. It's usually players who use their arms a lot, such as pitchers, who ask for an upper body stretch. We generally do these stretches before they go out to practice so that they are a little bit more loosened up. An important thing to remember when stretching someone is to watch their facial expressions and to ensure that they are not in any pain throughout the stretch. We briefly mentioned scraping and cupping, but here are a couple more in-depth clips. Both of these types of treatment are ones that we do pretty much every day with many different athletes. Scraping can help to reduce any muscle pain and break up muscle adhesions. Cupping is something that we also do very often. The purpose of it is to increase blood flow to the skin where the cups are placed and to relieve any muscle tension. Common areas that we do cupping are on the shoulder, lower back, and calves. Another fun thing that we have learned about halfway through this semester was ankle taping. Here is a sped up version of our technique. We first lay down a heel and lace pad to help prevent any blisters. Next is where we place the pre-wrap. We then use the white tape to apply different steps, which include stirrups, horseshoes, heel locks, and figure eights. This is definitely something that takes a lot of practice to get used to.
Over the course of this semester, we've been able to apply the information that we have learned throughout the exercise science program. We've also had the opportunity to grow in our knowledge with the hands-on experience that we have gained.
We've learned all about programming workouts, coaching in cueing form, and all the different rehab techniques. This experience has provided us with information that we will be able to apply in our future careers.